My name is Estrel, and I will be focusing on the healthcare system in Qatar. So Qatar is a very small country located on the Saudi Arabian border, and it is home to just over 2.5 million people. The healthcare systems in Qatar and the United States are pretty different. So in Qatar, they have a universal public healthcare through what's known as the National Health Authority. So the National Health Authority itself does not provide services, but it provides direction and guideline and funding to public institutions like hospitals and clinics. So the main service provider in Qatar is the Hamad Medical Corporation. So this corporation provides their services either for free or at highly subsidized rates to their citizens. There is, however, a growing demand for private insurance. So for people that can afford it, they're paying for higher quality services and lower wait times, as high wait times are often associated with public insurance. In Qatar, there are 4 general hospitals and 166 clinics that accept this private insurance. This is different than what we see in the United States, where most people are insured privately through their employer. However, we do also offer public assistance through Medicare and Medicaid for those that need it. The life expectancies in the two countries are relatively similar. So in Qatar, men can expect to live slightly longer than in the United States at 77.4 years. However, women can expect to live longer in the United States at 81.6 years, which is a year and a half longer than in Qatar. Overall, however, for the general population, the life expectancy is about 6 months higher in the United States than in Qatar. The healthcare spending in the two countries is really where we see a big difference. So in Qatar, they spend just over $3,000 per capita on health insurance and healthcare services, but in the United States, we see a spending of over $19,000 per capita. So as I mentioned, the life expectancies in the two countries are relatively similar, so we see a very big difference in healthcare spending, and that's one area of policy that I think can be improved, is spending our money more efficiently. I want to talk a little bit about breastfeeding support in these two countries, specifically in hospitals. So in Qatar, the Hamad Medical Corporation follows the World Health Organization standards as far as breastfeeding goes. So they encourage breastfeeding within the first hour of giving birth, as well as exclusively breastfeeding for the first 6 months of life. In the United States, we also see a growing support for breastfeeding support in the hospital. So we have what are known as the 10 steps to successful breastfeeding. 54% of hospitals in America follow all 10, and an even larger percent follow at least 8 of those 10. So as far as breastfeeding support goes, the two countries are relatively similar. I also want to talk a little bit about tobacco control efforts. So in the United States, as we know, there are very strict laws and regulations surrounding tobacco. So we have smoke-free areas where people are not allowed to smoke. We also have strict regulations on packaging. So companies are required to put warning labels on their packages of the health effects of tobacco use, as well as covering a certain percentage of their package with these warning labels. There's also a very heavy ban on direct advertisements for tobacco on things like television, radio, internet, print. So in Qatar, a lot of these policies are similar or the same. The main difference that we see is in the smoke-free areas. So Qatar does not have any of these public areas where smoking is not allowed, but as far as all of the other laws go, they're fairly similar. So Qatar also has packaging requirements in which companies are required to put health warning labels, and it has to cover a certain percent of their packaging. They also have a ban on direct advertisement for tobacco products in all the areas that we saw in the United States, so television, print, radio, internet. Additionally, the Hamad Medical Association offers anti-smoking campaigns in schools to prevent young children from getting interested in tobacco products and hopefully lowering the future use later on. Air quality is another big difference that we see between these two countries. So Qatar has the 4th most toxic environment by country. Their air pollution vastly exceeds safe limits. So on sort of the spectrum of air quality, the United States falls on the opposite end of that spectrum, in that we meet carbon monoxide air quality standards, and we're actually seeing the level of air pollutants decreasing every year. So This is one area of policy that Qatar could dramatically improve on, is increasing their standards for air quality. Because as we know, air quality is associated with a plethora of health concerns. So by improving air quality standards, we would hope to see an increase in overall health quality in the country. The number of uninsured adults is another area of difference between these two countries. So Qatar, as I mentioned, has a universal health care, so they offer their services to all of their citizens unless they decide to opt in for the private insurance. So they have a 0% uninsured rate, whereas in the United States, we see 12.2% of adults being uninsured. So as I talked about earlier, the health spending per capita is vastly more expensive in the United States, but we're also covering only 9 in 10 adults. So this is another area of policy that I can see improvements coming, is in spending this money more efficiently to be able to cover more adults in the United States. The unemployment rate is yet another area of difference between these two countries. So in Qatar, we have an unemployment rate of 0.1%, whereas in the United States, we see an unemployment rate of 4.1%. So it's much higher in the United States than in Qatar. However, Qatar does have a much smaller population. As I mentioned, they only house roughly 2.5 million people, whereas the United States has over 320 million people. To summarize, the United States spends vastly more money than Qatar on health spending. So we spend over 6 times the amount per capita than Qatar does. However, our life expectancies are relatively the same, and we don't insure over 1 in 10 Americans. So that's an area of improvement I can see in the United States, is spending that money more efficiently. Additionally, the United States, I can tell, puts more efforts into promoting public health. So when we looked at air quality and tobacco use, the United States had better outcomes and more efforts to promote the better quality and lower tobacco use. So that's one area of policy that Qatar can certainly focus more on, is promoting better air quality and lower tobacco use.